Hi, I'm Hannah Schmidt, and this is my presentation on eHealth Exchange and why it should be incorporated into standardized state protocols for future use. So, what is eHealth Exchange? eHealth Exchange is the largest healthcare information network in the country. It connects both federal and non-federal facilities. It is a single platform in which to exchange information. So currently it is active in all 50 states. It is in use in 75% of US hospitals, 8,000 pharmacies, and 3,400 dialysis centers. 6 out of 10 hospitals are using it currently. And it has increased a lot in the last 4 years, from 62% to 71% as well. And it does include 5 federal agencies. These are the Department of Veteran Affairs, Indian Health Services, Social Security Administration, Food and Drug Administration, and Department of Defense. So benefits of use, there's a lot of benefits of using the eHealth Exchange. One of them is decreased length of stay for ER visits. There was a study that was done that showed an average decrease of 52 minutes in ER stays due to availability of prior records. It did also see that there were 560 duplicate tests or procedures that were eliminated, and drug-seeking behaviors that were identified. It allows for better decision making due to having the entire picture, all the patient's history and medications and prior visits. And it has been shown to cut costs as well. And there are also benefits to eHealth Exchange in terms of claims being filed. There was also a study that showed disability claims. There was a 35% decrease in turnaround time for these claims being processed when they were done through the eHealth Exchange. And it has been perceived by physicians to save time as well. And the confidentiality is increased because it is the eHealth Exchange is a common set of standards and specifications, and these are set to allow for secure, trusted connections as well as interoperability between organizations that are participating in its use. And so for use for the future, there are, one of the downsides is that imaging results are not available through the eHealth Exchange, and they are available other electronic sharing sites such as Epic with chart review, and so that's a barrier to having increased use of this system, but they are working to develop a program which would require image sharing as well with the eHealth Exchange. However, this hasn't been passed into effect as of yet. But with making the participation more widespread, it makes the eHealth Exchange more effective when there are more organizations that participate. So having this imaging results available as well will help with that, with the effectiveness of that as well. And so there was also Intel has made the eHealth Exchange mandatory for all the organizations that they use for their employee healthcare. And so they're currently analyzing data from that to see the increase in care coordination, as well as decreased costs and turnaround time as well. So that's another interesting use potential for future data as well. For Medicare QIO reporting, this is able to be done via the hub on eHealth Exchange, which is a bi-directional exchange. It is a secure server for reporting this data, and organizations can earn reimbursements for using this as well to report the quality measures for Medicare. And so yeah, so there's different points that the hospitals and organizations can accrue if they are reporting their Medicare data through that system. And it does allow for also not just the disability claims, but claims for Medicare benefits for patients. That turnaround time has decreased significantly as well with organizations using the eHealth Exchange. In terms of social justice, the eHealth Exchange has helped with that because it does improve care coordination, especially in rural areas. And as of 2021, the use of electronic health information has gone up to 48% in rural areas. It was 26% previously, so there still is a long ways to go in terms of improving this care coordination in rural areas. However, it does allow for the social determinants of health to be addressed and is able to connect providers with community resources to find the best resources for these patients based on accessibility, language, distance they'll have to travel, and hopefully with integrating these social factors into health, it's able to change these outcomes for these patients and improve the care that they receive. So in summary, the eHealth Exchange improves communication between providers. It allows for increased patient access to records as well. There's better reporting for Medicare quality measures and reimbursements for that. And there's improvement in social justice factors. And the interoperability between systems allows for bidirectional exchange, which will create better care for the patient and more efficiency for providers as well as hospital system in reporting. So and there's the references as well.